Good afternoon, everyone. Hello, my name is Justin Rivas, and I'm a community coach with County Health Rankings and Roadmaps. I want to welcome you to today's webinar on how to use the new 2018 state reports to improve health and increase equity. This webinar will help you think about ways to move the data from these reports towards meaningful action to close gaps in your state and local communities. So the County Health Rankings and Roadmaps program is based here at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. I am very fortunate to be joined today with a small team of my colleagues, and I'll have them say hi as I introduce them. First, Annie Rubel is joining us. She's a population health analyst, and she's based in California.
Hi, Justin.
Hey, Annie. And Erica Burrows-Girardi, a webinar veteran indeed. She's a community coach as well, and she'll be answering questions and monitoring our chat throughout the webinar, and she's coming to us from Florida. Hey, Erica.
Hi, welcome everyone. Thank you for joining us today.
Great. So I'm actually going to turn it over to Erica now to walk through, help you guys to see how you can become active participants on today's webinar.
Thanks, Justin. If you joined us a few minutes early, you saw the video introduction, but for those who are just joining, we'll do a quick overview of how you can participate in today's webinar. If you have a question for our panelists, simply click on the Q&A control. When you do, the Q&A box will open up. Type in your question here, then click send to submit your question. And you can send your question in at any time. If you want to share an idea with all of the attendees, you can use the chat to make comments or respond to questions that we may ask of you in the webinar. To use the chat feature, click on the chat control, and the chat box will open up. Type your comment here, then press enter to submit your response. You have the option in chat to chat with all the attendees and with the panelists only, but we're asking that if you're comfortable chatting with all the attendees, please do so that other participants can see what ideas you're sharing. And then lastly, we will be using the raise hand tool today. So raise your hand to respond to a quick poll. Like for example, Justin may ask how many of you have seen your county snapshot, and if you have, you just simply raise your hand by clicking on the raise hand button. Don't worry about lowering your hands. I'll take care of that for you. So those are 3 quick ways that you can interact with us. And now just enjoy the webinar. Tossing it back to you, Justin.
Great, Erica, thank you. So now that you all are oriented to how to be an active participant, let's turn to what we really want to cover and get out of today's webinar. So first, we'll introduce the new state reports and how they are an evolved product. Next, since the state reports are really centered in equity this year, we'll get grounded with a definition of equity and also our approach to health equity. Then Annie will help us all understand the presentation of the data in the reports and really help us interpret what the data means. I'll then shift us to think about how to use what we see in these reports to really focus on and choose evidence-based strategies. And finally, we will explore other ways to leverage the findings in these reports to move towards action on these very important issues. So while many of you may be familiar with our past editions of the state reports, some of you may be asking, what exactly is a state report? These new reports kind of combine the previous state reports with the theme of the state health gaps reports we've done in the past. Basically, they dive deeply into equity by exploring the size and nature of health differences by place and race for each and every state. In line with our mantra of moving from data to action, these new reports also share evidence-informed strategies that can help improve some of the main issues seen in the data. You can find the reports online by clicking on Explore Health Rankings on our landing page, and then next clicking on Read Our Reports, and then just choosing the 2018 state reports and selecting the states you're interested in exploring. So what do these reports actually include? Well, the County Health Rankings has been illustrating for the past 9 years that where you live matters to your health. The new state reports take this a step further and show that health not only varies depending on where you live, but can also vary depending on your race or ethnicity. Hence, our goals with these reports are to discuss what health equity is and why it matters, differences in health outcomes within the state by place and racial and ethnic groups, differences in health factors within the state by place and racial and ethnic groups, and what communities can do to create opportunity for health for all. So let's pause here and hear from you to get a baseline on kind of your familiarity with the 2018 state reports. So I'll ask you to raise your hand now if you've looked at your 2018 state report, and it's plenty okay if you haven't. They just came out less than 2 weeks ago. And I'll let you continue to raise hands. Oh, wow. A lot of people did their homework. That's great. And it keeps going up. We're well over half the participants, so that's excellent to hear. Next, to begin thinking about equity, Erica is going to help us out with the following poll. So I'm going to ask her to launch the poll, and it's really asking how much you've thought about differences and opportunities for good health in your state. And I'll just wait a few more seconds. You guys are a very active audience. I love it. All right, we're almost at 3/4 of you. And it looks like well over half of you have thought a lot about this. And I think Erica can maybe share the results if she hasn't. So yeah, about 58% have kind of given this equity lens, if you will, a bit of thought. So let's pivot to that. So let's paint a picture here. Imagine a place where everyone has a fair and just chance to lead the healthiest life possible. Communities with high quality schools, good paying jobs, access to healthy foods and quality healthcare, and affordable housing and safe environments. Imagine a place where differences in race, culture, and perspectives are not only tolerated, but celebrated as fundamental to health and well-being. Imagine that this is how we all experience our communities, regardless of where we live, the circumstances we were born into, or how we look. This is really the vision of health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. Achieving health equity means reducing and ultimately eliminating unjust and avoidable differences in health and in the conditions and resources needed for optimal health by improving the health of marginalized groups, not by worsening the health of others. Our progress towards health equity will be measured by how health disparities change over time. These new state reports provide data on differences in health and opportunities in all 50 states that can help identify where action is needed to achieve greater equity, and they offer information on how to move from data to action. But why equity? This graphic helps us understand why equality isn't enough to close gaps. The same resources or opportunities available to all really isn't enough. And you can think about this with the example of the graphic. An adult bike would not allow everyone to ride safely to get to where they want to go. And some could not even ride it at all. Also, our youth is really the argument for why we need to focus on equity. Our nation's youth is becoming even more racially diverse, and because we know that children, youth, and families of color do not have the same opportunities and are often much more worse off when living in segregated communities. Finally, investing in all youth by giving them fair opportunities to thrive will ensure a healthy and prosperous future. So let's really shift to thinking about equity as opportunity. We know that health gaps emerge and widen when some groups of people have more access than others to opportunities, resources, and wealth over a lifetime and across generations. Differences in opportunity are not arbitrary, but they are the result of policies and practices at many levels that create deep-rooted barriers to good health. Health equity can be achieved by reducing and eventually eliminating unjust and avoidable differences by ensuring the needed opportunities for these marginalized groups. But before we dive into an example of this material, let's kind of assess where you all are at with this approach. So one more chance with the poll here, and I'll ask Erica to launch it. So it's a kind of a derivation of the same question, right? So we're asking, how much have you thought about differences and opportunities for good health based on race and ethnicity? You guys are getting even more efficient with the polls. It's awesome. We're actually seeing a really similar trend. So it looks like about 65% of you have really given this kind of racial perspective to how we think about equity a lot of thought, which is great. So let's dive into an example. So essentially, it's crucial to remember our history and understand the historical causes of inequities. We often hear broad terms like structural racism and historic systems of oppression. So let's think about a concrete example involving federal public policy, discriminatory housing standards, and segregation. We know that access to affordable and quality housing is key to good health. Generations ago, during FDR's New Deal, the federal government started subsidizing certain housing. Some programs exclusively allowed whites to move into new suburbs, like Levittown, New York, for example, and to buy homes for around $8,000, or roughly $125,000 in today's dollars. While blacks, for example, were prohibited from buying these homes, even if they could afford them. This discrimination cut off opportunities for those in urban areas. And remember, it's not just about trying to move out of urban areas, it's about families not having the same opportunities to prosper like others. Over the decades, those suburban homes greatly increased in value, creating wealth that got passed down through generations for white families, supporting them to send their children to college. Even though the law changed in 1968, allowing blacks the right to buy into places like Levittown, most homes increased in value and became unaffordable at that point. And today they're selling for over $500,000. So let's fast forward, and acknowledging that there are many factors influencing health. If you compare the neighboring Bronx and Nassau counties' county health rankings, you'll see that Nassau is ranked 3rd out of 62 counties in New York State, and the Bronx is ranked last, 62 out of 62. Almost 40% of housing in the Bronx is characterized as having severe housing problems, while Nassau is only 23%, which is less than the New York State average. Further, Nassau County median household income is triple that of the Bronx. So making quality housing more affordable by providing access to home ownership and leveling the housing burden across race will improve health. In the short term, higher quality housing could mean better indoor air quality and air and water quality, and in the long term, access to home ownership and or decreased housing burden will increase wealth or family income that can lead to better opportunities for health. So bringing this example back, how can you use data and evidence to start to curb the effects of these kinds of historical patterns? For this, I want to refresh everyone on our theory of change. This picture shows us that the thinking behind how population-based data, in this case the state reports, can be a catalyst for action that improves health and increases equity. So let's walk through this. We start with population-based data from a variety of sources. Then we use the data to rank the health of nearly every county in every state. Ranks, in turn, turns out to be great for garnering attention, and each year the rankings and these state reports generate national, regional, and local media attention. Data also provides an opportunity for people to tell the story of the many factors affecting health in their community, what's going well, and where there's opportunity to make things better. When thinking about what things can improve health, we can start with community members identifying evidence-informed strategies that can be implemented to really make meaningful change. And over time, these strategies ultimately result in longer, higher quality lives for everyone in a community. So ultimately, the rankings and the data in these reports are not just about numbers, but they can be a strong call to action. And you can use these reports and the themes in the data to either start or continue conversations about health. I'll talk about how we can use this as a call to action in just a bit, but first I'm going to turn things over to Annie to share about the data in these reports.
Thanks, Justin.
Sure thing.
Okay, so you all know that we're the county health rankings and roadmaps, as Justin just said, and the rankings are built on the foundation of data and using data to improve health. Data is a resource that can be used to assess your community needs, compare yourself to others, track changes over time, measure the impact of specific interventions, or to understand what differences occur among subgroups in your community. We are committed to providing communities with the most reliable and up-to-date data in order to make informed judgments. This approach is similar for the state reports, just as it is for the county snapshots. Although state-level data can be found in the snapshots online, we have provided a more in-depth look at health and health equity within states through the updated state reports in an attempt to make them more useful for community members and state teams. These reports are available for all 50 states and Washington, D.C. This is the first year we've included additional data on race or ethnicity in addition to place. The state reports are available online at the website that Erica is going to chat out to you right now. And as I go through this section, feel free to open your own state report to start thinking about the data patterns you see. If you would like additional hard copies of the report for your state, we're happy to provide those as well. Please either contact your state team lead or use our Get Help button at countyhealthrankings.org. Throughout this webinar, I'll be looking at examples from different states in order to highlight that there is no one state that is a perfect example. Each state faces unique challenges and the data will be different within them. This presentation is meant to get you to start thinking about the patterns that occur in your state and the reasons for those patterns. So what's in the reports and what's new this year? In the past, the state reports have included the health outcome and health factor maps you see here, along with health outcome and factor data for counties in your state, which correspond to the county snapshots online. This year, we've added more state-level data by race and ethnicity for overall health outcomes, as well as health outcomes and select health factor measures in order to highlight some of the disparities that may exist within your state. These are all additions to, and we believe improvements on, the report compared to what has been published in the past. So what data are we using in the state reports? We use the same measures and weights that are used to create the county level ranks. The measures we include are years of potential life loss before age 75, poor or fair health, poor physical health days, poor mental health days, and low birth weight. The years of data and data sources are the same as used in the snapshots. We follow the same procedures for data reliability and calculation of health outcomes rank. And thus we construct an overall estimate for each measure by race and then use the assigned weights to create an overall composite health outcome score by race using z-scores, just like we do for county snapshots. So here's the outcome data table for Louisiana. You'll see a similar table in every state. The columns indicate the different racial groups we included: American Indian or Alaska Native, Asian and Pacific Islander, Black, Hispanic, and white, all of which are exclusive of each other. Races are identified according to the data source, but usually through self-report or on birth or death certificates. In addition, we have columns for the healthiest and least healthy county in your state for comparison. The rows again show those 5 measures which contribute to the health outcomes ranking. Just like in your county snapshot, the health outcome values are just a starting place. You should really look at the raw data itself to see what it might show you. If you start digging into the data, you can see that for the least healthy county in Louisiana, the YPLL value, or years of potential life lost, is still higher for the least healthy county compared to all races. But Asian and Pacific Islanders and Hispanic populations fare better than the healthiest county for YPLL. These trends differ by measure and race, so it is important to use this table with the summary graphic presented in the next slide to make an informed assessment about how different races fare on health outcomes. Also, you will notice that in general, Hispanics tend to perform better on the length of life measures, but when combined with quality of life measures, we often see they have worse outcomes. Thus, it is important to dive into the different measures in order to understand what might be occurring in your state and how that compares to the same group in other states. Please note that if an NA is shown, such as the case here for Asian and Pacific Islanders, this stands for not available. The data is most likely not provided due to data reliability issues such as small sample sizes. And this is the summary graphic for Louisiana. And bear with me as I orient you to the graphic, even though half of you had seen it. So that's positive. But for many people, this is the first time they're seeing it. So in the middle, you see the box plot for counties. And it shows the top and bottom ranked Louisiana counties, as well as the 25th and 75th percentiles and the median for Louisiana counties. These correspond to what you would see in a health outcomes map. The vertical axis here is actually the composite z-score from worst to best in your state. Thus, the axes are not comparable across states. The third column is the health outcome race values, where each flag is a race. The takeaways for races in Louisiana is similar to what we would expect from the data table. We expect Asians and Hispanics to be among the best and Blacks to be among the lower ranked counties. There's a substantial disparity between the Asian and Hispanic racial groups, white and American Indian, and then Blacks. That is, there are gaps between the flags. When we compare the racial distribution to the county distribution, we can see that they cover approximately the same distance. Asians and Hispanics are performing slightly better than the top-ranked counties, while Blacks seem to be among the 4th quartile, or the worst 25% of counties. The distribution here implies that health differs as much by race as by place in Louisiana. And this is especially apparent because 4 of the 5 races perform similar or better to the top 25% of counties. What we are really interested in are the gaps between racial and ethnic groups. If the state has races all clustered together, this would indicate low racial disparity.
So can I just jump in, Annie, and just want to ask kind of why is this important?
Oh, good question, Justin. And actually, that will lead right to my next slide that I already flipped to, but back there. So the distribution we'll see in Louisiana will not be the same when we look at other states. So again, this is just one example, and every state will have different graphics and thus different outcomes. So we encourage you to open other state reports to see how the distribution might change by state and what that will say for disparity in relation to your state. So Louisiana, the graphic is here on the left with 3 additional examples. And I'll just give you a main takeaway for each one. So in Wyoming, you see clustering in the middle where American Indians fare substantially worse than the worst county, implying a large racial disparity. While in Mississippi, Hispanics rank well, and the race with the worst health outcomes is just slightly in the bottom quartile. In Montana, there's only one race in or near the top performing quartile. And as a researcher, I would ask myself what differences are occurring in these states where there is relatively little dispersion among races, and what those states might be doing differently. I encourage you to look at this graphic in your state and try to make sense of where races are falling in line with the county distribution, and to think about policies and programs which might have led to these outcomes, or conversely, what could be implemented now to help reduce these gaps. Again, if you need help interpreting the graphics for your state, please use our Get Help button to reach out to us. We're more than happy to help.
Annie, this is really useful, and I just want to let everyone know that I'll be highlighting some county health rankings and roadmaps, tools, and resources a bit later in the webinar to really think about what to do about these important gaps that you're showing us.
Thanks, Justin. So, and as you all know and have seen this model multiple times, we want to emphasize again that differences in health do not simply occur by health outcomes. They are also seen in health factors. In the state reports, we highlight 4 health factor measures related to social and economic factors to illustrate how different gaps in health can occur by measure within states. You will notice that even within a state, the patterns you see by measure might be completely different. This may lead you to identify areas that will become priority areas for focusing on to reduce health disparities. And according to our model, a reduction in any health factor disparity should over time lead to reduced disparities in health outcomes. So now I'm going to switch our example to Kansas, where I'll guide you through the 4 health factor graphs included in the state report. We include data and graphics for children in poverty, high school graduation, uninsured, and teen birth rates. Each graphic has 3 distributions you can compare: the US value for counties, the state's counties, and the racial and ethnic groups in your state. Again, those flags. Similar to health outcomes, you should look at how the racial distribution in your state compares to the county distribution in your state or the US. You'll notice we label the best and worst and have grid lines that help you understand the values for each racial group. For the true county values, or to determine which county is the best or worst within your state for these measures, please combine the state report data with the data on countyhealthrankings.org. You'll notice that for children in poverty, American Indians is missing. This is because the data isn't robust enough to compute an estimate. You can see in these graphics that data on children in poverty by race are relatively distributed similarly to the counties in the state, with Blacks having a worse value than Kansas's worst county. We can also see that the distribution in Kansas is fairly good compared to the US for children in poverty, in that the US median is similar to the worst 10% of counties in Kansas. The high school graduation rate in counties and races in Kansas is very similar to the US distribution. However, the data is a bit more clustered, and Hispanic children experience the lowest rate of high school graduation. We might consider policy implications or systematic biases that are occurring for states or measures that see a distribution that is not so clumped as Kansas.
Thanks, Annie. This is really, really great. And I want to kind of pause here because I know we're talking a lot about the data and the numbers, and we're getting deep into these box plots and these graphs. And I just wanted to kind of come back to why the connection between children in poverty and hence decreased opportunities and hence worse health outcomes is really so important. So I want to kind of just ask folks to raise your hand again if you've even looked at the children in poverty measure on your own county snapshot. And just go ahead and let us know if you're familiar with this measure and have even looked at the broken down data. Great, it looks like still coming in strong, but nearly a quarter of you have, so that's really good. So I'm going to carry on with just a little bit on the children in poverty measure. It shows us the percentage of children under 18 living in an impoverished family, and this is broken down by race in nearly every county. We all agree that every child deserves the opportunity to grow up healthy, but we know that this isn't always the case. Today, 1 in 5 children grow up in poverty in this country. The burden of poverty falls heavily on children of color. Child poverty rates for American Indian, Black, or Hispanic children are higher than rates for white children, and that is true in almost all states. We know that poverty limits opportunities and increases chances of poor health, and too often kids who start behind stay behind. So children living in poverty are really less likely to have access to quality schools, have fewer chances to prepare for living wage jobs, which can lead to upward economic mobility and good health. This measure is also important because it's an upstream measure that assesses both current and future health risk. Child poverty rates remain at levels higher than those of the pre-recession era, despite declines in recent years, and the recovery has not been felt by all. Rates have been slow to rebound in rural counties and in those with greater share of people of color. So I'll hand it back to Annie to share a few more of these measures where we see some stark disparities.
Sounds good. Thanks, Justin, for taking us back to why we include that important measure and why we highlight it in the state reports. So our 2 other measures are here in the graphic: uninsured and teen birth rates. And a good example of counties distributed widely by race is uninsured, where Hispanics fare worse than the worst county in Kansas. These gaps could be due to numerous issues and can be mitigated through programs to improve accessibility for English as a second language, better jobs, or better healthcare. Programs might need to be culturally tailored to these groups in order to improve health outcomes for all, and thus reduce gaps in health. We see that Hispanics in Kansas also experience a higher teen birth rate than other races, followed just after by Blacks. While whites, American Indians, and Asians are similar to the best 10% of counties in Kansas, and all fare better than the US median. There is good news in that nationally we see teen birth rates trending down for all races, which means that these gaps are starting to close. It is important to note that reductions in health gaps will likely lead to better improvement overall for the state and for the counties that those racial and ethnic groups reside in. It is not that place or race and ethnicity matter, but rather that place and race and ethnicity matter. The interplay of race and place can be very difficult to untangle, but these graphs give us a starting point to understand where to better target interventions and how to begin those discussions. And I'm just going to pause here to see if any questions came in, Erica, through the chat that I might be able to answer on the methodology before we jump into Justin's section.
Okay, yeah, great. First of all, I just want to thank everybody for really chiming in through the Q&A box. We've had lots of questions. We have lots of interaction. So thank you. I want to remind everybody to use the Q&A box if you have a question. We can answer them there faster than we can through the chat, because sometimes with the chat, they scroll up and we may miss it. So I do want to remind you to use that Q&A box. And of course, you can ask your questions at any time. I also want to let you know, we have had a couple of questions. Folks want to know how they can get this state report. And we did chat out a link to how you can access your state report. That is a PDF that you can download. If you'd like to have a hard copy of that report, just feel free to download it and print it out. That said, Annie, I do want to tell you, I do want to share a couple of questions with you right now. Can we continue to compare counties, like county by county, like we've done in the past on the snapshots?
On the snapshots, yes. So we still do that on the snapshots. And we still use the same methodology and measures where we use the weighted z-scores to compare across counties and create a rank. But what we really encourage people to do, as Justin mentioned before in our kind of model, is that really you want to look at the data themselves. So the ranks are really a media attention grabber, but really what matters is the data, and there's a lot of useful tools within the snapshots themselves to help you do that and compare counties. Even a compare counties tool that you could use. So.
Good. And then Michael Howard wants to know, why do we compare to state means and top performers rather than national averages?
Oh, well, and that's a good question, but as the county health rankings and roadmaps, we're really focused on local data and policies and programs that can be changed locally. And so the state provides a better comparison for that for our purposes. But you can see in these graphics, we do include the US values. And then on the snapshots, you'll see that we include a national benchmark for another comparison that gives you a comparison for your county.
And then another good question that came in is, why did we pick the racial and ethnic groups that are featured in this report? And what are the limitations on including more specific racial and ethnic groups?
Oh, that's a great question. So we would obviously include as many as we could, if we could, but there's some data limitations in terms of sample sizes, as well as how races are identified across these different measures. So these are the 5 races that we can identify and have generally good sample weights across all counties in the US, and then that they're identified the same way across these 5 data sources.
And one more question before we toss it back to Justin. Do we plan to disaggregate Asian Pacific Islanders in upcoming reports?
Not at this time, and that's basically due to a sample size limitation, but not because we don't want to do it, but because
Okay.
it's a sample size.
Right, right. So keep the questions coming, everyone. These are excellent questions. I'm so glad that you are participating. Justin?
Thanks, Erica and Annie. And I also just wanted to chime in a little bit on that, comparing to the state and national level from not a data lens, but from more of a policy change lens. I think it's important to think about that this is a very large and diverse country we live in. So what you see regionally, what you see in your state, and understanding kind of, the limitations and policy arena you live in within your state, it's kind of more important to see how other counties and communities are faring within the state, knowing that you have to operate kind of in that same arena, if you will. So it gives maybe a sharper lens to have that local perspective. And I have one more question for Annie, because I just want to let everyone know by answering this question, hopefully you can help them, just to make sure that all these measures we've already covered, they're still available at the county level too, right?
Yes, so most of these measures we have disaggregated at the county level by race, and you'll see those on your snapshot where it's available, as well as for additional, or other measures, I should say, other health outcome measures. So we're happy to share that, or to go to your snapshot and use that data, and as data becomes available, we're going to keep putting those up on our website every year.
Great, Annie. Thank you. So onto those measures. That was very convenient. You timed it well. I was going to add one more poll for everyone, and I wanted to kind of ask everyone's opinion here on, I'm going to ask Erica to launch this poll, and to really know what measures that are broken down by race and ethnicity are useful to you here, and you can choose all that apply, and you can even scroll down the bar. There's actually 10 options, so if you don't see them all on your poll screen, scroll down and take a look. And I'd also like to know that your responses here are really helping inform our data team in their future work. So Annie and her colleagues appreciate this very much as well. And you guys are really active. I love it. Gosh,
Justin, this has been one of the most active groups we've had.
I know.
So this audience is amazing.
I can't even, there's so much, it looks like a lot of you are interested in a lot of these measures. Is that a categorical statement? It looks, yeah, that's great. I'm saying children in poverty again is one of the top ones, median household income. So again, some of those social and economic factors, definitely very important. The birth weight, teen births, great. So thank you so much, everyone. Erica, you can share those results and close that poll. As you do. So just some questions to really consider here lastly as we think about the state reports. First of all, what differences do you see among counties in your state? And you can use these questions to kind of help you think through these reports. What differences do you see by racial and ethnic groups in your state? How do counties in your state compare to all US counties? And what patterns do you see? For example, do some racial and ethnic groups fare better or worse across a variety of the measures? All right, so to think about moving to action, let's do this by coming back to how the County Health Rankings and Roadmaps program works to support communities. We seek to bring people together to look at the many factors that influence health and help them select strategies that can improve health for all and close gaps, and ultimately make changes that will have a very lasting impact. We do this by providing data, evidence, and guidance for communities, and we also work together and share stories of communities from around the country that are really at different points on this journey to serve as examples and inspiration to us all. So since we just explored the data, let's move to evidence. So our What Works for Health tool will help you find evidence-informed strategies or policies and programs that are a good fit to address the gaps you're seeing in your state's data. You can find What Works for Health under the Take Action to Improve Health on the main navigation bar tab. And let's look at what it includes. So What Works for Health is really a living resource, as I like to call it, because our well-committed evidence team is constantly updating all of these strategies. And there's over 400 of these evidence-informed strategies in this tool as of today. Each strategy in What Works for Health includes an evidence rating, and the evidence ratings convey the likelihood a strategy will work based on best available evidence. They include a short literature summary that highlights the populations that a strategy can really benefit and the outcomes it can achieve, and when possible, if there's information about the cost of the strategy. The disparity ratings, which is entirely impertinent to this conversation today, and those help communities really use this equity lens we've been talking about as they explore the strategies. And lastly, there's implementation resources to really think about how to move from ideas to action. And I like to think of this resource as really our evidence team has done all the homework for you, and there's a lot of really good stuff here to dive into. So finally, if you're a state with disparities in populations that live in rural areas, we have a separate report that dives into a subset of strategies proven to work in rural areas. And you can find this report in the report section of our website too. So each state report connects to the content of What Works for Health, which I think is really useful. So on page 10 of the state reports, they cover basically these 4 approaches to closing gaps. And within these 4 approaches, if you will, there's a highlighted 3 to 5 strategies or so that reference back to What Works for Health. And these 4 approaches include investing in education from early childhood through adulthood to boost career readiness, ensuring that everyone has adequate, affordable, and culturally competent healthcare, increasing or supplemental income and supporting asset development, especially in low-income households, and fostering social connections within communities, and empowering and engaging youth with opportunities. So let's move from the evidence piece to guidance, and that's where the Action Center comes in. The Action Center, which you'll find under Take Action to Improve Health on our website, provides step-by-step guidance and tools to help you move with data to action. The Action Center answers really the question, how do we move forward to take action? Each step here is broken down into key activities with guidance and suggested tools to support your work. I like to think of the Action Center as a destination, really, and you can click into the guide that seems most useful to you at the time, review the related key activities, and choose really what resonates with you. The most important thing to remember is that although this is a destination, it is a just-in-time resource that you can revisit to find the right resources when you need them. So a pro tip on that is to bookmark this Action Center in your web browser, and you can come back to the resources as they align with your needs.
And Justin, I just want to let you know that I just chatted out a question to the audience about what do you see happening to create health for all in your community. So feel free to share that information with everyone. Do make sure that you share with the panelists and attendees, because we love to hear what's happening where you are, and I know the other attendees want to hear that too.
Great, and thank you, Eric. And if we have the time later on, we can share some of those excellent examples of what you guys are sharing in your communities. So thanks for that. So some final things to keep in mind here. When thinking about moving to action, we should really employ a multi-level approach with these reports. So when reviewing, think about whether your county differs from the state trends you see in the state report. This multi-level approach can really help you think about stakeholders too. One of the key messages of county health rankings and roadmaps is that everyone has a role to play in improving health and advancing equity. The state reports can really provide an opportunity to connect or reconnect with stakeholders in your community to gain a local understanding, and also help you think about the state level influencers that could use this information to really affect policy change. Hence, these reports can be an excellent policy advocacy tool. They can be used to help shape policy that can benefit every county in the state. Think about who are your state lawmakers and champions behind doing this kind of work to really increase opportunities for good health. And advocacy itself is really rooted in a strong call to action. So remember, we compared data, whether with county ranks or with disparities in racial and ethnic groups, as in these reports, because it's provocative. We want to get people talking and to gain attention. When using these reports as a call to action, think about being proactive with the information. Who needs to know this, right? And how can you share it with them? For example, the media can help you connect with a broader audience, and we'll talk about some tips for engaging with the media in just a bit. You might also use this as an opportunity to connect directly with decision makers, to either start or broaden the conversation about health and equity. Such decision makers could be, for example, elected officials. So plain and simple, elected officials have the power to change policy. At the state level, some groups have held meetings with legislators, sometimes at a legislative breakfast, for example, or other event, and sometimes they've just gone and done individual visits to specific legislators to share the state report and their county level data when it's applicable for the areas they represent. This year, we hope that the new state reports that provide information on differences in your state by race and by place provide an even more compelling reason to reach out and connect with state elected officials to talk about how they can support creating opportunity for health for everyone across the state. And at a local level, you might think about bringing this to the Board of Health or County Board, maybe to your mayor or even other community officials as you see fit. This is likely going to depend on the size of your community and what, if any, relationship you have with these folks already. But again, just like with media, know what the story is that you want to tell before you go in and what you're really asking them to do. So let's jump into that just a bit. Connecting with the media is a key way to reach and influence decision makers, including the broader public as well. If you have a strong message you can glean from what you see in the data in your state report, then you can use that to help garner media attention. And here are a few tips. So first, you really control the story. So think about the story you want to tell from the data. Next, your story should really focus on action and assets. So what's the call to action? What's the ask? Finally, think about who can help you tell this story. Are there partners you should include who can increase media attention by telling their story, specifically those who have some lived experiences that really relate to what you're seeing in the data? This can also increase your credibility with those key decision makers. Lastly, there are many ways to deliver your message beyond media. Here's a list of some effective options. So you could opt for a press release, those one-on-one meetings I was discussing, conference presentations for those of you that have opportunities to present and engage with the broader public, specifically phone calls to those decision makers, op-eds and letters to the editor in local publications, social media, and lastly, paid advertising is an option too. So I know I've kind of gone through and covered a lot here, and we've covered an abundance of material today thanks to Annie's great help. So now I want to pivot. We have about 15 minutes actually to take some time and really field your questions. So for that, I'm going to kick it on back to Erica, and we'll dive deep into trying to help answer some of your questions.
Yeah, and first, Justin, Annie, thank you so much for that great overview of our state reports. I'm hoping that everyone will be able to see just how useful these state reports will be as a tool to help you take action in your community. And some of the things that we're seeing in the chat box is incredible. I mean, everything from finding ways to increase social support among community members, collaborating with hospitals, expanding walkable communities. This is some really great stuff. Thank you so much for sharing that information in the chat box. Remember to share with all the panelists and attendees so we can all see all the great work you're doing, like racial equity trainings, even health coaches between the hospital and the local college to keep readmission rates low, all kinds of really unique and just new ways of being able to create health for all in the community. So thank you so much. we have had a lot of questions that came in through about data, and I'm going to try to list some of those questions, but Justin, what I want to do is start with a question for you first, and then we'll transition back into data. But how can the state report be helpful to my partnership, which is focused on just a few counties in our state rather than the whole state?
That's a really good question. I think it's back to that kind of approach we really have of relativity, right? So if we're seeing some kind of patterns across those few counties that are engaged in the partnership relative to those state trends, whether it be that you're maybe far behind or far ahead, using that context to really inform how to move the work of your partnership. For example, if you know, if you're doing really well in some measures in terms of that low disparity, right, compared to the rest of your state, then you could really think about how to share your learnings and be that kind of exemplar partnership, right? And on the converse of that, right, if you're falling behind, looking at those state trends and seeing where you're really doing differently in those, and starting to ask those questions about why and how to approach that. So I think having that context of the state to the local is very useful.
Yeah, you're absolutely right. And we're also getting questions about the presentation slides, and some of you may have missed that I did chat out a direct link to the slides for this webinar, but if you did, that's okay. You just need to, you can actually find a PDF of the slides on our webinar webpage at our website, which is at countyhealthrankings.org, and just click on this particular webinar about state reports, and underneath it you will find underneath the registration part is still up now, but you'll find the handouts for today's webinar. We will also have a recording of this webinar available most likely within 24 hours, and that will also be on the website. Annie, I have a question for you.
Okay, Erica.
So this is a question you probably hear a lot about comparing ranks across states. How can we best do that? That's actually kind of like two questions in one.
Yeah, so don't compare ranks across states. that is, but what you can do is use the Compare Counties tool on our website. So if you go into any snapshot, on the top tab, there'll be a Compare Counties tool, and you can add counties across state lines or counties within states. Actually, quite a few counties at one time, and look at the data that's in every snapshot, and we provide a little bit of guidance about data across state lines, but most of the measures are comparable. So that's the best way I would do that, to dive into the measures, because ranks are, we only rank within states, so the rank isn't comparable across states because of the limitation of the number of counties within each state.
Could I jump in real quick? Annie,
Yeah,
do you want to maybe speak to the peer communities, peer counties?
Oh, that's a good thing, Justin. Yeah, so this year we added with some team at CDC's the peer counties feature. So you can also go into the snapshot, and if you don't have a county that you want to compare directly to, we've provided with their work some counties that are similar to your county in terms of demographics, social and economic factors, etc. That you might want to look at, and it's a good starting place to see where you might be performing better than some of those counties, or where you might have work for improvement. So it just gives you a good place to look to see counties that have similar demographics to you, especially if you're in a county that doesn't have that within your own state, perhaps.
Great, thank you, Annie. Justin, we had a question about how, using the state report as a tool and getting the media involved in this, and they want to know how could they talk to the media about this report? Like, what are some messages that they could send to the media that would grab the media's attention about the report?
That's a really good question. I think it's important to think about the specific media outlet that you're working with, do some research on them and know kind of maybe how they've covered health or social issues in the past before you really think about the way you're framing your messaging, because that how you're appealing to both that media outlet and their audience in general is important. And to do that, we have a really good tool called 2793 on our website, which helps craft a very concise elevator pitch message, if you will. And we can send out a link to that from the Action Center, but it'll help you kind of take the theme of what you want to talk about in relation to these equity issues and kind of distill it to a concise message as it relates to the media outlet you're working with. So that would be my response to that.
Yeah, yeah, and so I will text out that link in just a second. Also, I was thinking this person who asked the question, that was a great question, like you said, Justin, reach out to us also through our website, because one of the coaches might be able to help you in a little bit more detail about how you could craft that 2793 message. So don't hesitate to reach out to us, and we can offer you some support there. So now you can tell just how old I am, because I totally forgot the question I was going to ask. Okay, I just found the question, sorry. Justin, this question is related to the differences between urban areas and rural areas. And state reports are very general, but there's differences in rural areas as opposed to urban areas. So where could they get some support with that?
That's a good question, and I think I'd pivot right back to the answer you just gave. It's good to reach out to, you can use the Get Help button on the website to speak specifically to a coach about a specific area if you want to talk through some of those details in thinking about that. I know that, for example, in the Key Findings Report, our other annual report we put out this year, there's a really strong section on thinking about residential segregation and how it is a fundamental cause of health disparities, and looking at it in urban areas. So I think that if you haven't looked at the Key Findings Report yet and read through that section, it's a good way to help think about some of these issues and how they look different in different demographic settings. So that would be my best way to kind of respond to that. And again, you can look, if you're trying to focus more on rural areas, you can look at the rural report again from What Works for Health, which provides strategies again, but it's kind of tailored to that understanding and seeing that.
Yeah, and I want to let you all also know that we have a resource sheet that's going to have the link to that report that Justin just talked about, What Works in Rural Health, What Works. And that resource report is also online right now, but you can access that, and that has all will link you directly into it. But you can also go online on our website and find it as well, that report. So I don't see any other questions coming in at this time. I do want to offer an opportunity, Justin or Annie, for you to have any closing comments. Uh-oh, one just came in, sorry. You're not off the hook. So one person is curious. They're experiencing some challenges with evaluating different programs, and they wanted to know if we have a resource for that related to evaluation, Justin.
Sure. As I brought up the Action Center earlier on, and I know I just kind of did a hand wave to it briefly, but if you go to the Action Center on our website, we actually have a whole host of key activities that are aligned with evaluation, and there's both on kind of process and what the content of different kinds of evaluation would look like. So that'd be a great place to start.
Okay, so I'm just going to toss it back to you to close it out.
Sure thing. And I just want to let the whole audience know that Erica is not that old, but so we have a great webinar coming up, and that is on a community that has brought together 30 service providers to collectively prioritize 5 key factors to ensure school readiness for all kids by age 5. So this is called 5 by age 5. It's preparing children for success. I circled the date and time of that webinar, and this is actually a screenshot from our website. So this is what it would look like if you want to click on that register button. And that is on April 24th at 3 p.m. Eastern, same time as this, 2 p.m. Central. Of course, please stay connected with County Health Rankings and Roadmaps. Lots of ways to do that. You can follow us at CH Rankings. You can like us on Facebook, /County Health Rankings. We have an e-newsletter, and you can email chr at match. I think it's, yeah, match.wis.edu. Just subscribe. So stay connected, please, and we'll hopefully see you on future webinars because of that. And I just wanted to do a big thank you to everyone. Thank you to Annie and our data team for their support, our whole evidence team that's really done all of the work behind the scenes for all these strategies we've talked about, and our community transformation team, so myself and Erica and the folks that really helped to kind of engage with this material to the general public. So thanks to all those folks, and especially thanks to the audience for being here today. I really appreciate you taking your time out of your busy days and hopefully helping to share this information and continuing to do the excellent work you do in community. I want to offer up just here lastly that we are going to do an after class session. We haven't done one in a while in this format. It's very casual. We'll just stay on the line for another 15 extra minutes or as is needed to answer any other further questions and to really just kind of help follow up if you guys have any other concerns. And if you're not going to stick around, please have a lovely afternoon, and we'll catch you soon on another County Health Rankings and Roadmaps webinar.
And Justin, as we transition into our after class, someone did want to know, can we flip back to the slide about the next webinar?
Sure thing. Are you seeing it now?
Yep.
Great. And this, again, you can register for this on our website. This is just the screenshot of our webinars page. You'll see upcoming, and that's where you'll also find this webinar recording. It'll be under past recordings, obviously, after today.
And I am going to go ahead and send that link out. There's folks wanting to know how they can register for the webinar. So I'm actually going to send that link out through the chat. Look for that link so you can go ahead and register for that webinar that's on April 24th.
Great. And then just reminders for this after class session as we get into it, please just continue to offer up any questions or inquiries you have to Erica, myself, and Annie, any data questions.
I want to give a shout out to a couple of people that I see on the webinar. Is that okay?
Oh, I suppose, Erica.
Yeah, Erica, there's some really good stuff coming in. I feel the same way. I'm trying to read it all.
Well, I want to give a shout out to a couple of folks from Alabama and that are participating in today's webinar. Isaiah Lineberry, who probably didn't know I was going to call his name out. Well, I am now. And Martha Vignes from both from Alabama. Thank you for joining us today. And Annie, is there anything you wanted to share about what we see coming in through the chat? So many good ideas.
No, I'm just so impressed, and the diversity of what is coming in is amazing. So
it is.
And I know I'm missing them because they were coming in so quickly, so I'm excited to read them afterwards.
Yes.
Erica, do you have anything else, any other questions coming in?
I don't see any other questions coming in that we want to lift at this time. There are questions that we need to answer offline because they're pretty specific. So I just, I would love to be able to give you guys an opportunity to just make any last comments, and then I think we'll give everybody back some time in their day.
Sure thing. I just want to reiterate that this state report, we see this really as kind of a a groundbreaking year in terms of being able to really center equity in the work that's being done. So I want to make sure that folks really are able to take advantage of that and use this report as it's really calling attention to looking at health and what contributes to health through a different lens, and really being the positive influencers who can maybe make change in closing these gaps. So I'm really excited that people are involved in and interested in this this approach.
There's one person saying, Cherry Houston had a question about strategies that work. If you want to go ahead and put that question into the chat box, we can if we have time to answer it. But I also want to encourage you to go online to our website and look for what works to health and what works for health. That link, and that may be able to answer your question. So. Thank you. Thank you, Justin. Thank you, Annie.
Great, everyone. Well, I'm going to close out the webinar, and you have a lovely afternoon, and we'll see you all really soon. Take care.